Hi, everybody. My name is John Norco. I am a pediatric fellow in the Hematology Oncology Department at Connecticut Children's as part of the UConn Fellowship programs. I'm presenting today a patient of mine and Dr. Besler's who had a very rare disease and was subsequently treated with a unique combination of chemotherapies and did quite well. Was able to get into remission because of it. To start off, he presented, he was an 11-year-old boy who presented with horrific back pain and an inability to walk, and presented emergently to our ER, got MRI of his spine, which subsequently demonstrated a 6 to 7 centimeter compressing lesion of his thoracic spine. He was taken immediately for debulking surgery with neurosurgery, and subsequently that tissue was sent off for diagnosis. It was quite a difficult diagnosis to make, but ultimately was found to be an aggressive form of a peripheral T cell lymphoma, which can also be called a mature T cell lymphoma, which is highly unusual for a pediatric patient. So in the literature, we found 3 other cases reported ever of a child who had a CNS-based peripheral T cell lymphoma, and none of those cases actually had metastatic disease. So he is unique to the literature as far as we can tell. Likewise, he is unique in that we then had to develop a treatment plan that does not have a standard of care. So we based our treatment on a lot of adult data and some expert opinion to work out the best treatment for him. So we treated him with induction and consolidation for a T cell lymphoplastic lymphoma protocol, and then subsequently treated with high-dose methotrexate and EPOC, which are the chemotherapies are listed there. As you can see on his pre and post PET scan imaging, he had disease in a lot of locations, including his pancreas and spleen, and as well as his bone marrow, and his post-therapy PET scan was negative for disease. And his, as you can see, pre and post MRI also looks substantially better. Ultimately, after these cycles of chemotherapy, he was sent to Boston for an autologous stem cell transplant, which he got through well, and came back to us. Unfortunately, he, at about 130 days out from his transplant, did relapse, and so we are actively treating him once again for his disease with a unique combination of drugs in an attempt to get him back into remission. But he is an ongoing, very interesting case, and because of his unique sort of presentation and nature of his disease, was worthwhile to present both at a local recent hemalignancy conference in 2019, and was due to present to him at ASPA, which is our pediatric hematology oncology annual meeting, but unfortunately was canceled due to COVID. But this is my very interesting and unique patient, his presentation, his treatment so far, and his outcomes. Please let me know if you have any additional questions. I'm happy to answer any questions about him or our treatment options.